Hello, Dr. Greg here again. I'm going to continue on with sugar part 4 next week, but I needed to do this because I thought it was very important. I want to talk about exercise impact on COVID-19. Now, I did a whole exercise series on its impact of mature brains, the cognition, the thinking of mature brains, and how positively exercise affects it, and certain kinds of exercise, whether it's resistance training, whether it's aerobic training or mind-body, and how all three combined together are extremely beneficial for our thinking brain. A couple studies just came out, and there's some other studies that I'll talk about, but I just wanted to touch upon them. After I'm done with the sugar series, I'm probably going to dive into this even deeper because there's a lot of implications about exercise and how well it can help you, even when bad things come along, like cancer or kidney failure or anything like that. If you exercise before these things and you're relatively healthy before, you have a better chance of survival and a better chance of not having to take as much medication, if at all. So let's look at these. The first study is from the Department of Family and Sports Medicine in Kaiser Permanente Medical Center in Fontana, California. Now, I'm just going to read the results of these tests and what was the outcome. Patients with COVID who were consistently inactive had a greater risk of hospitalization, admission to the ICU, and death. They had a greater incidence of those who were more active. Now, the second study, which I thought was interesting, is an ongoing study. Now, before I go on, the amount of individuals in these studies are in excess of 48,000 people they studied, which is unbelievable. So they couldn't do these studies before COVID because you didn't know about it, but it's been over a year, and they can actually figure out, use test subject and find out what these type of activities, what kind of impact it has on patients who get COVID. And if they don't do anything, if they're inactive, they actually are hospitalized, greater incidence of hospitalization than those who actually do something. And the exercise doesn't have to be remarkable. That's where the second study comes in. A study focused on physical activities requiring little physical space and equipment that are easily completed at home. The study includes yoga, movement-based activities, and promotes relaxation, mindfulness, and only requires space for a full length of width of one's body and a mat equipment. So you don't need a lot of space to do these, like the exercises I showed you before. Those kind of exercises in limited space are very effective and can help in helping your immune system fight off this COVID thing. Now, the third study is a physical exercise as a tool to help the immune system against COVID-19, an integrative review of the current literature. In other words, let's look at a bunch of literature about what the effect of exercise has on your ability to fight COVID-19, and this is what they found. The benefit of exercise for the immune system in respiratory infections, and that is COVID-19, a respiratory infection, a lung infection, include an increase in immunoprotection, improved immunocompetence, in other words, the immune system's ability to recognize that COVID-19 is a problem, which help in the control of pathogens. So your immune system just functions better if you exercise. Now, this other one is interesting. Before COVID, they were just looking at something called secretory IgA. Now, secretory IgA is the element that protects your mucosal membranes. It's sort of like the first line of defense. I talked about using something called monolaurin, which is found in coconut, that increases secretory IgA. So secretory IgA is all about defending the castle walls, in other words. So you have the castle walls, which is your mucosal membranes, your mouth, your nose, the digestive tract, the stomach, everything, all the way down against the ability of viruses and pathogens getting into your system to cause damage. Now, regular moderate exercise seems to enhance the mucosal immune system, increases the secretory IgA. Now, they did this on elderly subjects. So elderly subjects have compromised immune systems, so it behooves you to increase that first line of defense. It increases it by 50%. So they did a measurement of secretory IgA before the exercise, and then 12 months of exercise, regular moderate exercise, nothing extreme, and they all increased by 50% on average. So exercise has a lot of benefits. A lot of benefits, not just for your brain, but for your immune system, for fighting this COVID-19. And also there's a theory that even when you get the vaccine, that'll actually help the vaccine work better. It behooves you to be healthy. It behooves you to be stronger in your system. It behooves you to do these things to help you function better. So in other words, what you attend to, what your body and your mind attends to, you want it to be good for you. You don't want to sit there and watch TV all day long, because that takes away energy from you, takes away energy from the brain, and actually takes up your attention, and you become that. If you sit on a couch all day long, you're attentive to sitting on a couch all day long. But if you exercise and eat good foods, get away from the sugar, which we're going to talk about later, and how sugar affects the immune system, you actually improve your body because you're attending to good things. So that's all I have to say right now. There's going to be more next week. We're going to get back on track with sugar next week. I just thought this was an important thing to talk about. So this is Dr. Greg, changing the way you look at health.